Hello everyone, welcome you all in our YouTube channel Learning Radiology. Then start our today's topic. Today we will discuss on the topic Doppler, Ultrasound Doppler. Firstly we see in a Doppler introduction about Doppler. Christian Doppler was described the term Doppler in 1843. A Doppler is a form of ultrasound which measures frequency shift. A Doppler uses diagnostic information is encoded as frequency shift in returning echoes. Now we see on the Doppler principle. Doppler principle means whenever there is a relative motion between a sound source between the source of sound and the listener, the frequency heard by the listener differs from that produced from a source. Now we see Doppler effect. Doppler effect is a change in the perceived frequency of sound emitted by a moving sources. And Doppler shift. Doppler shift is a velocity of sound in particular medium and frequency of oscillator determine the wavelength. If a source of our sound moves toward the listener, the waves begin to catch up with each other. The wavelength gets shorter and so the frequency gets higher. Clinical application of Dopplers are how fast blood cells move, ultrasound reflect off the blood cells and cause the Doppler shift. Usg Dopplers, there are terms like a velocity towards transmitter gives increased frequency and velocity away from the transducer or transmitter gives decreased frequency. There are three types of Doppler: continuous Doppler, pulse Doppler and power Doppler. In pulse Doppler there are two types of Doppler: duplex Doppler or called as a duplex scanner or color Doppler. Continuous wave Doppler. In continuous wave Doppler, two piezoelectric elements in a single head. They are angulated toward each other. The diagram shows in a diagram they are angulated toward each other. Continuous Doppler used continuous transmission and reception of sonic waves. They provide only velocity information. A scattering of Usg by blood. There have two types like specular reflection and Rayleigh reflection. In specular reflection from solid structures. In Rayleigh reflection, tendril scattering like reflection from rough surface caused by RBCs. Advantage and disadvantage of colored wave Doppler. Advantage are detection of high flow velocities, inexpensive, narrow spectrum, which provide high measurement accuracy, no aliasing artifact. In case of disadvantage, lack of depth discrimination, error due to motion within path of continuous wave ultrasound beam. Application like superficial structures would used for arteries within eyes, female breasts, obstetrics to breast to detect fetal heart motion. Pulse Doppler. Pulse Doppler provides both velocity and position. Pulse Doppler only one transducer element used. Newer pulse is not transmitted until the echoes are obtained from previous echoes are called as until the echoes from previous is received. A sample of volume or depth gate is used to obtain flow information from a selected depth. After the transmission, receiving transducer is turned for short period. Operator control the depth by selecting the time of the system. Pulse repetition frequency. Maximum number of pulse repetition frequency is dependent on the depth that needs to be assessed. Higher velocity waveforms require higher pulse repetition frequency for adequate assessment and vice versa. Advantages are like precise depth at which flow is detected can be specified. Flow information from a small portion of a vessel can be isolated and analyzed without interference from flow in adjacent areas. A duplex scanner. Duplex scanner means Doppler system plus real-time scanner. Real-time ultrasound image is obtained and the image is frozen. Then the Doppler mode is switched on. Operator positions the location and axial length from which the Doppler signal will be obtained while locating the appropriate cursor on the frozen image. Duplex scanner obtains signal by getting on the transducer to receive Doppler shift signal from one point called signal range gate. Color Doppler. Color Doppler produce imaging of flow throughout an entire real-time image, which allowing the visualization of blood vessels. It's possible to obtain larger number of Doppler signals simultaneously from selected points along the ultrasound beam. Application like carotid cardiac peripheral veins imaging, evaluation of deep vessels, investigation of organ and tumor perfusion. Power Doppler are much less angle dependent. No directional or positional information are used to visualize small vessels. Power Doppler estimate the power and or strength of a Doppler signal rather than mean frequency shift. Difference between continuous wave Doppler and power Doppler. In continuous wave Doppler receive and transmit signals same time, but pulse Doppler transmit a pulse. It doesn't transmit second signal until first is received or getting. In continuous Doppler image only velocity. In pulse it gives velocity and depth. In continuous Doppler there is narrow range. In pulse depth can be controlled. Continuous Doppler have high frequency and pulse Doppler have low frequency and wide range. Continuous Doppler are used for a superficial structure, whether the pulse Doppler are used for a deeper structure. Continuous Doppler are used for no aliasing artifact, and pulse Doppler have aliasing artifact. And difference between color and power Doppler. Color Doppler provide velocity and depth information, and power Doppler provide power and strength of Doppler signals. Color Doppler estimate mean frequency shift. Power Doppler doesn't estimate mean frequency shift. Color Doppler are more dependent on angle between sound beam and direction of blood flow, and power Dopplers are less dependent on the angle between sound beam and direction of blood flow. Color Doppler gives directional positional information, and power Doppler doesn't give directional positional information. Minute vessels are not well visualized in color Doppler, whether minute vessels are well visualized in power Doppler. Color Doppler are used for carotid peripheral vessels, and power Doppler are used for minor renal and hepatic vessels. Thank you. Comment on this video, like the video and subscribe the channel. Okay.